All right, we're going to demonstrate how to use a handheld Nmes, neuromuscular electrical stimulation machine this morning. This is Alyssa. Good morning, Alyssa. How are you? Alyssa's a master's OT student, and she's volunteered for this demonstration. So one of the first things you want to do in preparation is to clean the area that the electrodes will be placed on, and you can use an alcohol swab for that. And so today we're going to be working on Alyssa's wrist extensors and finger flexors. So clean those areas nicely. If you have a person who has a lot of hair in the area, you'll want to clip the hairs 24 hours before putting on the electrodes and not shaving, because that can irritate the skin. And what we're going to be using is a handheld machine for this demonstration, and it has the capability of having 4 electrodes total, so 2 on one and 2 on the other. And so when you're getting ready to do the Nmes, I want you to have read your chapter in Rossiano on electrotherapy. It has excellent information about the current, the waveforms, the interferential versus Russian stimulation, the different parameters, amplitude, duration, rate, and frequency, and all of that information. Especially look at the contraindications, which are on page 193, indications and precautions for use of electrical stimulation. And also on page 208, there's some recommended electrode placement for the upper extremity. And you also have a website on Blackboard that shows you about the electrode placement. You have different scenarios that you'll need to practice for your competencies. All of our competencies currently are using, for the handhelds, are using the symmetrical preset settings of either 3 or 4, and we're using small electrodes, round electrodes, or oval electrodes. And there are also some information in your lab book on precautions and waveforms and that type of thing. Okay, so after you've cleaned the skin, you want to plug in the electrodes to the machine. And if you turn it on, you'll see some yellow lights, so you know that the battery is working. There are some pre-programmed settings for this unit, and if you look at numbers 3 and 4, neuromuscular electrical stim, or NMES, are used primarily for increasing range of motion and increasing muscle strength. All right, and then we'll be using these 2-inch round electrodes. In class, you'll be issued your own set of electrodes, and you'll put your name on them, and you'll use them for the whole course, just for sanitation purposes. And that's what you would do with clients or patients in the clinic, is assign them their own electrodes that you would use when they come in to the facility. And so I'm going to put the first electrode on the extensor carpi radialis longus and brevis, and we're going to put the second electrode on the finger flexors. All right, some electrodes stick better than others. You want to make sure that you're on the muscle belly and not the tendons for the finger flexors. And I think, Alyssa, if you'll just keep your hand in a neutral position, I think we'll get a better movement than if you had it, your hand pronated. All right, and so let's see. All I'm going to turn the machine off and program it before I actually attach it to the electrodes. So if you can do custom settings or you can do pre-programmed settings. So let's see. On this setting, it's on 5 seconds and off 10 seconds. The rate is 35 per second, and it's a symmetrical waveform, and it's synchronous, and there's no ramp time. So what you really want to do is want to make sure that the on time is about 1/3 of the off time. So if it's on for 5 seconds, then you want it to be off 10 to 15 seconds. All right, so let's see. All right, stop just for a minute.